Hi, my name's Fiona. I'm a clinical nurse consultant. I work for the Sydney Youth Cancer Service. My role varies a lot. We have to be quite flexible with what we do. So for a young person newly diagnosed with cancer, my role in that would be, first of all, just to obviously meet and greet the patient. It can be to do with orientating to the hospital environment, which is something that we sort of do up front. It's meeting their family, their siblings, finding out about, finding more information about the young person, and then providing them lots of information, I guess, up front, the kind of information that they want about around their disease, around the treatment, around side effects, around other resources that are available to them outside of their hospital and outside of cancer. We work closely with our other team members, so we work with the social workers and the clinical psychologists and medical staff, obviously in allied health, multidisciplinary teams to try and coordinate that care. So for the young person, that can be us making sure that all their appointments are coordinated. So it can be, calling them and just making sure that they're not doubling up and just being the point of contact, I think, is a really important thing. So we're the person that, we give them our phone number up front if they're not in the hospital or they're coming in for stuff, to make sure that we're the person that they can call so we can sort out any of that sort of nitty-gritty hospital environment stuff. We also do education around, as I said, their disease and their treatment, so that's another thing. Communicating with them sometimes can be a hard thing, but up front trying to just making sure that all the lines of communication are open, working out who they want us to communicate with. If it's a 15-year-old, do they want us to communicate with them directly? Do they want to communicate with mum? We make sure they're aware of all the processes of confidentiality around their cancer diagnosis, and again, those lines of communication, who they want information given to. We're patient advocates, so we advocate for them around all their treatment and around just things like with regard to appointments. Sometimes we're the person that they'll ring and say, hey, I really want to go to my mate's 21st on Saturday night, is it okay if we change that appointment? So that kind of stuff. We do a lot of patient advocacy, advocating for them in a younger person in an adult ward, so that kind of stuff. We also make sure that the staff at the point of care are educated in caring for a young person, because often they end up in environments where the staff aren't that familiar with working with young people. It might be like an adult haematology ward, so we sort of go in and make sure that the staff caring for the young people are educated and aware of some of the healthcare differences that these young people have. And that can all be in one day, like all that stuff, that can sort of be in one day and around one patient. So we also make sure that these young people are, like, their outside needs are being met. As I said, we work closely with schools and universities, so that's another big part of our role. We go out to, if it's a Year 12 student, for example, we'll go out, like with the patient's permission, go out to their schools, meet with their teachers, make sure that all their educational needs are being met. So, for example, HSC is coming up, so we've been in touch with any of our schools that have HSC students and make sure that all the paperwork for special consideration for exams is all done. So we do a lot of liaising with schools for that. We do liaise with universities. Often the problem with universities is, they got sick just past their payment date for their fees for university, so we liaise with unis to sort out that sort of stuff. Workplaces, often it's writing letters for, this is the treatment plan and this is the amount of time they're going to need off, so we do a lot of liaising for that sort of stuff. Part of our role also is working with their peers to make sure that their friendships are being maintained, or that their friends have enough information to support the young person in an appropriate way, in a way that's useful for them. Also that they're not being overwhelmed with lots of stuff. So we educate families as well about what to expect. So I guess really in a nutshell, clinical nurse consultant is really there just to try and lessen the impact of a cancer diagnosis on a young person in whatever way that might be. All those things, socially, medically, like educationally, vocationally, all that sort of stuff. So we are sort of like the overseer of all the treatment, I guess.